Hi, everyone. We're back with Dr. Khan, co-host, Dr. Anili Khan, clinical psychologist, psychotherapist, speech therapist in Pakistan. And she just reviewed with us the commands, instructions, and requests. Yes. And she shared with us the differences of those three different types of communication with people, especially if they have autism or an at-risk situation where there might be a processing delay or motor skill issues, things like that. So Dr. Khan, I did have a couple questions, and maybe they're not even questions or just kind of pointing things out that you said. You mentioned about repeating something over and over and over again. And I know that for myself, with being a mom of autism, repetition is super important because sometimes short-term memory has so many roadblocks because there's so much oversensory that the information doesn't sustain in the long-term memory. And so is the reason for the repetition and just constantly ingraining that for the purpose of long-term memory sustainability?
Let me tell you one thing. And sometimes, yes, that is very important that you have to. So if the things stay over there, because in the short term memory, we have picture of that thing, and
Yeah.
then they go to back, and sometimes they have to connect with something as well in our back in our long term memory. But the point over here, the repetition is important because, and you have to think over here as well, that this is the repetition of the efforts too. What efforts you are doing, you have to repeat those efforts on daily basis. It's not like you said that, okay, let me do something with my child today, I'm going to repeat same thing for 5 hours. It does not do a good with you and with the child as well. So with repetition and performing, because you will not just, you are repeating through your performance, you are showing him something that I want you to do this, and you ask your child to perform that. So it's not necessary that you start doing that 100 times, repeat, you do this, do this, do this, the child don't, and sometimes child feel frustrated and child feel overwhelmed too. So wherever we have to do this thing, we have to need to this. If the child is not doing that, then don't start scolding him. Just go there and help the child to do that.
Yeah.
Okay, maybe repeat 2 or 3 times, and if the child don't do that, then help your child to do that. So be supportive in that man, and repetition should be the repetition of the efforts as well. So for example, you said that I'm trying to help a child to learn certain command of some officer, some firefighter. So what are the commands? I need to perform those things. I need to create different scenario for the child to understand that it could be play therapy, it could be visualizing something, it could be in the form of picture. We could create some kind of play for the child, like we are doing these things in our therapy. And we are, for example, if it's ABC, for example, what I do when I'm working with a child, I do everyday phonics drill. The drill means you are drilling thing every day. But I don't do this the whole session. It might be 5 minutes on daily basis, so that the child know the drill of the phonics. Either the child is getting that or not, I will do that in any way. And according to my, and this come in my notice, that I was working with a child, and in start he was not even not responding to me. And after 6 months, same things were coming from his mouth, same form of my the way I was teaching that child, the way I was I was singing those poems to the child. For example, let me give an example. It's a box, okay, the box is on. For example, this is the handle. Mr. Handle, Mr. Handle, where are you? Here I am, here I am. How do you do? So, same kind of phrase was coming from his mouth. So, you're getting the point. The point over is that he learned those traits. And let me give you one example. And child start doing the same thing in other things as well. For example, I was saying, and the child was saying, Mr. Shoes, where are you? Here I am, how do you do? So he was repeating that thing for himself. But child was not responding to me at that time. So I don't get this hurt from that thing, the child is not responding me. And I tell those people, to the parents, like she was saying, I'm working with a child for 2 months, the child is not giving me eye contact. I told her, do you know that for how long we work on child for same thing on average on daily basis, how much effort we put over here? So they, and people think that everything is eye contact or everything is language. This is a wrong concept. I work with a child who have a lot of sensory needs, and I have to turn off the light. There was a dim light coming from the, and There should be no noise. I have to talk very slow with the child, because the moment I stop, because when you're speaking, you need to be clear and loud. So, and you have to be your notes as well. You have to do some practice always on daily basis. But at that time, I need to talk very slow. Plus, I cannot watch to him directly, because he would get very uncomfortable. He would start like, stimming. He would start stimming, and he would start, if the loud noise, he would start doing that and doing that. He will hold his mouth, and he will put my hand on his hand so that I can feel his pain. So what I used to do, minimum light, and not even the flashlight, that tube light. It should be natural light. Then there was a mirror in front of me, and I have to look at the mirror and do certain things. And he was looking directly at mirror, so I have to show everything in the mirror, and he was looking at that things. So, and he was very comfortable then. So the moment, if for example,
go ahead,
I know that the light is gone and there will be noise, I don't take that session. So because I know what will be the child problem. So these are things like that.
And then you also said, make sure that you give enough time between each command for them to process the information and be able to perform the operation that they're asking, or commands. And if it's complex, you're going to have to give them even more time, because they're going to have to really decipher what you're asking them to do. And if they've never heard this command before, it could be very difficult because they don't understand the words of that command. Yeah.
And the point over here is that you cannot give complex command to, and if you want to introduce something, then you need to start from simple thing. For example, it should be monosyllabus, one step instruction, like simple instruction, one step. It could be complex instruction, or two step instruction, 3-step instruction. So whenever you are doing that, don't think that the child is going to, from start, it should not be a complex command. Like from simple thing, but you could do that, because you need to plan that thing, because you are planning some activity for a child. So it need to be start from simple thing. So like, for example, I'm doing something, if the child is not performing, I don't even wait for the child, and I don't put the child in the position that he have to do that. Because the moment the child feel that we are at the hot seat, we have to do certain thing, then they feel sometimes little discouraged, they feel shy too. So what I will do, if I clap my hand, clap. So me and the child is doing same thing on regular basis. I'm also doing, I don't sit like a boss and ask that child to do that. It's never like work like that. You have to be maximum involved and equally involved in the same thing with the child. Equal involvement is very important. So from simple to complex, first thing. Second thing is that do certain activity, and you will see that the child get that confidence, and he will start doing that even without you noticing that. He will do that by yourself, but don't put that pressure on the child that he will do that. So I think that's the idea.
Dr. Khan, something they say is like, does the child do it independent, or is it hand over hand? So for example, if a child doesn't understand, put your hands in the air, you could always show them a picture of somebody, like you did with the coffee cup and the table.
Let me tell you how you can do that. For example, you want me to hands in the air, like hands up, and hand is a very big difficult command. Hands up, just like that. So you can show a picture of hands up to the child. Okay, just like that. First picture, hands up, and you hold the child hand and do like that. Until and unless this child start doing that, what could be the second step? Then you need to work on that. What could be the third step? Then you need to work on that. Like do this. So everything is stepwise, and put as many sensory stimulation as much you can. So it could be visual, your command, you are asking your child to do certain things, and you doing the same things too. So don't forget to put this thing in your mind that you have to do the same thing too. That is what does that mean? What do you want that child to do? So it will be like that. And there's another activity. It could be very efficient if you work with a child and adult as well. If 2 or 3 people are doing the same thing, they learn more effectively like that. But in the start, it should be between you and the child. Then you can do. But it's not a very difficult process, because maybe if it's a child, then we have to talk about a lot of things. But when if it's an adult and he can understand a lot of things, we might don't need that much time for that. But we need to be careful that The command should be the same all the time. Don't even change the words in start. Maybe if the child know what to do, maybe he comprehend those things because the child can. But in start, if you're introducing something, then it should be stepwise. You know the instruction. Other person know the instruction. Up, hands up. Even if it's the hands up, look back, do this, hands back, and these things like that. And also think about that. Other activity command should not come into that activity. You need to think about that as well. So you need to plan, for example, when I'm working with child, so A and triangle is in coming same space, you know, A and triangle. So I have to design different cues for that. And I have to know that the position should be different so that when I put 3 dots and I ask the child to write A, he does not draw a triangle.
Yes.
So I have to add more dots in A. For example, I don't have, then I don't know, I have not. But
that's how Landon, Landon spelled his name because he traced. Yes.
Tracing is important, but you know, all the time you cannot ask your child to trace on A. He need to know that these are my cues and I have to write A. And he will write independently. And if you said that hold hands, one day if you are standing with hand with the child and you ask him hold hand, and he will do exactly like you. But confidence will come with the time. We have to work with that. It's not a difficult thing, I'm saying, if these are adults, but maybe a little bit tricky, but they can do that because you know I am the one who always have the confidence on children. I'm not the one who give up on the people. I'm not the one who I think that everybody can do everything in sense if they have the capacity to do that thing, and we need to push the limit also. That is the point. So just support them and they will do wonders for you. But you don't have to an extra. I like you know, I mentioned it so many times that why the child is not doing that, other children are doing, why he's not doing that. So these are the things because everything have a wiring in our brain. Memory is kind of a pathways. For example, what are the neural pathways? For example, you spill something on floor, every drop go in different directions. So by repetition, we are making a different pathway. And that is going to become a muscular memory. This is in OT language, they call it muscular memory. So it will become their muscular memory, and the moment it becomes muscular memory, it will become automatic. That's why we repeat things.
And then, Dr. Khan, if they know what the A looks like, let's say that becomes a part of their muscular memory, could you say to them, because I know that many of these kids are literal thinkers, could you say to them, look at your cereal boxes and look for the letter A?
They can do that. Yes.
And they could do it.
You can do that. Let me tell you one thing. I was working with a child and I asked her to write A, and I was just doing a tracing. You know what she started doing that? She used to trace everything. Newspaper, boxes. And you can do that by sorting activity. Where's A? Let's find out A. They can do that. Yes, they can do that.
And I do have one more question. So let's say that we teach something to the child, but then we're teachers and we don't have time to work with them every day on these tasks. Would you recommend taking their peers in the classroom that have learned how to do it and show them and continue working with them on the skill?
Yeah, they can. It is a very good way.
Yeah, because I think they learn.
For 2 minutes. Over here, Suzanne.
Sorry, Dr. Khan. I have allergies. So we're back with Dr. Khan, Spectrum Talks and Tips International. And Dr. Khan is in Pakistan, clinical psychologist, psychotherapist, speech therapist, and more. And we're talking about commands, request, and instructions. And we've been asking a lot of questions to Dr. Khan today about the different ways to incorporate for people on the autism spectrum or at-risk population, special needs, anybody that has something where their memory takes a little bit longer to process information, and they're able to do these fine motor skills or commands or instructions, you know, in a repetitive manner. Dr. Khan said you have to start small, you have to start slow, and you have to take it one monosyllable at a time, and eventually it becomes a complex sentence structure. And so, Dr. Khan, some of the things that you said about the mono, just one word and then kind of moving into that slower thing. And then you were talking about even doing dots for the letter A all the way to Z and how a child could trace that. But eventually that's just a guide for them until they can start doing this on their own and they understand the muscle memory of writing that. One of the questions I wanted to ask was when you do the dots on the A, for example, is it would you say that it's a good idea to remove maybe one of the dots on like the side and then they could actually draw on the dots and trace, but then that one side is missing and they have to draw it, and then next they move like another line, and eventually you're removing all the lines and then it's there like it's stuck.
I don't know. You have seen when I'm posting the child video. I think I did not post because we are on vacation. But when I'm working with children, I think I still have those videos. In STAR, the tracing is on the dots. These are small dots. You are not teaching them to write on lines. It's not like that. Maybe there's a big A, but these are small dots, and you just put 3 dots or 4 dots or 5 dots in a word. Okay, I don't know I can have that board or not, but let me see if I can use whiteboard. And I will show you. I don't know I can do that or not.
I added whiteboard to our
do we have that? Then I will teach.
Yeah, we should have it to Zoom. It should be on the bottom. There you go. Good.
Okay. For example, if I'm asking a child, I'm formatting something. I knew that it's A. So
yes,
what I'm going to do? This is a big dot. This is a marker dot. Getting the point?
Yes.
Then, because all the time when we work with a child, we cannot ask them to write on dots. They have to write independently. And we are very much successful in that because child can do that with the passage of time, with specific instruction, the child can do that. So it's like that.
That's perfect.
So it's like that. So when the child know how to write A, this is done with practice. Then I will ask a child to write A on these dots. So I don't need to put even a line over here. But the child know that that's how I need to write A. Then the child will do it by himself. Or if either it's a big dots, it's not even a line here. You're getting the point?
And do you give them an example next to where you want them to do what you just showed me so that they see and visualize, or because of literal thinking, do they even know to identify that A to this A?
We have to make this practice that let's write A. And I need to tell them what I mean him to write, how he needs to write A. Because I will, okay, if he's not able to do that, because writing is a very complex activity, but the child can do that. So I will ask that, okay, let's write over here. So I need to make that practice with the child that from these 3 dots, I mean that write A. Even in the start, we hold the hand of the child, then literally we don't have the hold the hand of the child, and the child is doing that thing. I don't know. I have videos of that thing, but the child can do that. But you need to plan everything. Is either reading, because when we talk about reading, then these are phonics first, sounds. Then we join 2 sounds, then 3 sounds. Then that's the method a, k, a, ch, cat. And we have to practice that blending. Then after blending, we go toward families like at family, ig family, ip family. Then these things get difficult. But everything is gradual. So I think it's more like that. So it's not just even about the letters. You can teach them number 2. You can teach them shapes too. Like you can teach them writing. So I think it's more like this. So that's why I explore that these are the important skill. And I think child can, and not just I think, I know I am fully confident on that the child can do that.
I love it. Well, thank you, Dr. Khan. I think that we covered a lot of stuff today, but I think it was super important. And I think this will help a lot of families, especially those that are just starting out at the pre-diagnosis stage where their kids are just learning and they're developing their motor skills and their speech skills. All of these little tips are things that I can remember going back when you showed me this. Landon's 20 now, but 18 years ago, these are things we were working on at 2 and 3 years old. And by the time he got to kindergarten, he knew shapes, colors, sizes, alphabet, all those things, because we worked on it 30 minutes to an hour every single night after dinner.
A lot of time, you don't need to give a lot of time. Parents would say that the specific therapist asked to give us 3 to 4 hours daily. I said, no. Quality matters over here. What you're teaching your child matters over here a lot. And you have to plan one. You don't need to do one thing. You can do 3 and 4 things in the same time, so that the child don't get bored for that thing. And the child's capable of doing those things. Not that they cannot do that. But the point over here is that we need to understand that the child can do that. It's not that the child cannot do that, but everything systematic. And I would like to comment on one thing, because you asked that question before about the pair. Yes, you can involve pair, and it's very important. Involve pair, involve friends, involve community in that, involve family in that, so that they can learn effectively. And what I do when I'm working with children, and those children who are now at stage that they can go to the normal classroom, so I ask them to continue the therapy and send them into the school where other children are sitting over there, so that they understand important skills of sitting span, attention span, how we have to sit, what is the meaning of these things, what does that mean, what does that mean that we have to raise our hand when we have to, that social skills. The child learn it more effectively when the child is between those children who are atypical, who are not atypical. I think they're called typical children, who are not atypical children, and who don't have that much behavior problems, or who are on better stage, or so-called they are normal people. Norm is a very relative term. So it's better you start doing those things, so that the child learn, and they learn very fast, because they identify with them so quickly. So it's more like that. So I think that was important thing to consider, these facts. And the point over here is that every child can learn. You just need to teach them differently.
Well, and I think that you said it, like patience and all those kind of things. Like, I know that when I couldn't do certain nights when I sat with Landon, we didn't skip it. We would just make sure that Alexis, our sibling, sat with him, or Dad sat with him, or we put on like a cartoon that might show him. We did all kinds of different things to model the behavior that we were looking for, so that it wasn't just the same thing over and over. My voice, we were doing my voice. I was showing him. I was making him watch videos, having his sister do it for him, because modeling is very important, right? So they see somebody else doing it, and then they copy what's being done. So this is all good stuff. I really appreciate you today, and we'll see you guys next time. Thank you.